Hello, everyone, and welcome to the Kaplan Nursing Lunch and Learn series. I'm Dr. Christi Doherty, Executive Director of Nursing and iHuman Patients, and I'm delighted to have you join us today. The goal of our Lunch and Learn series is to provide strategic insights and practical solutions for nurse educators navigating today's evolving academic and clinical landscape. On a regular basis, we'll bring in experienced educators and leaders to address high-impact topics that directly influence student outcomes, faculty effectiveness, and program success. Each session is intentionally designed to be both strategic and practical, connecting emerging trends with real-world application. Whether the focus is student engagement, clinical judgment development, curriculum strategy, or faculty support, our goal is to provide insights that you can immediately translate into impact within your programs. Now, today's topic is student engagement in nurse education. Engagement remains one of the most pressing and complex challenges facing nurse educators. As learning environments shift, students' needs diversify, and expectations for clinical competence rise, the ability to actively engage students is no longer optional, it is essential. Meaningful engagement drives clinical judgment, strengthens confidence, and supports long-term retention of knowledge. It's foundational to preparing practice-ready nurses. Now, before we begin, I encourage you to actively participate. Please add your questions in the chat throughout the presentation. We'll reserve time at the end for our speaker to address your questions and engage in discussion. So now it's my pleasure to introduce you to our speaker for today, Julie Hamilton. Julie is an experienced registered nurse with over 30 years dedicated to healthcare and nursing education. She began her career specializing in women's health, specifically in labor and delivery. Julie earned her Master's of Science in Nursing from Regis University in Denver, Colorado, focusing on leadership in healthcare systems and education. Her advanced education launched her career in academia, where her expertise allowed her to take on diverse roles, including interim program chair, developing nurse curricula, and establishing new nursing programs. Julie has shared her knowledge by presenting at local, state, and national levels. Julie currently serves as a nurse educator consultant here at Kaplan. Welcome, Julie.
Thank you, Dr. Doherty. It is so great to be here with all of you. So let's dig in and let's get this started. So first, let's talk about our purpose. Dr. Doherty went over that just a little bit with us, but I want us to really grasp the importance of engagement. So in an era of evolving standards and increasingly clinical complexity, the bridge between classroom instruction and professional competency has never been more critical. This academic webinar is designed specifically for nursing educators seeking to ensure students can apply clinical judgment in high-stakes environments. And that's what we're seeing now. And so it becomes more and more important for our students to engage. What are we going to do? Well, the first thing we're going to do is we're going to define student engagement. We're going to determine why engagement is important for our learning, discover activities to promote engagement, and we're going to discuss a few of the interactive engaging activities that I've got here to display for us to think about. So I want to welcome you. This session is grounded in current nursing education research with reliance on the backbone of history and evolution of engagement. When you think of the word engagement, I want you to think, what comes to mind? This session is going to be practical, it's going to be interactive, and it's going to be designed to support real-world teaching challenges that you face. So here's one of those challenges. To effectively bridge this gap between classroom theory and professional competency, we want to promote a consistent pursuit of student engagement. As the standards evolve and there is a heightened clinical complexity, engagement is required in all learning activities. This includes active involvement of question-based practice, clinical and critical decision-making, targeted and purposeful remediation. We want to make sure this is sustained, deep engagement that builds clinical judgment necessary for success on the NCLEX and for professional practice. So let's talk about this. And feel free to interact in the chat. When you hear the word engagement, what's the first thing that pops in your mind? What's the first thing that you think about? And feel free to put it in the chat. This is a safe place for all of us to kind of think about. All right, I like that, Catherine. Action, right? We're doing some action. And I often think about, just like in relation to engaging, related to, being there and doing something, right? Commitment. Yes, that's one of the things that I thought of. And that's why I put it on my slide. I thought, well, commitment, right? And the first thing I thought of was marriage. Like we think, oh, I've got engaged. Well, I've made a commitment, right? I've made a commitment to this other person. So it is a commitment. I totally agree. It is an action. What else do you think? Active participation. So participation is part of engagement. Interest. I love that. Any other ones? Looks like that's presence. Oh, Melissa. That is so, so important. Presence. Because what happens with students, and we've got to think about that, how do we get them engaged? Because it's difficult right now to engage them. But we want them to be present. And a lot of times students are worrying about maybe other factors in their life. They're worried about this upcoming test. They're so consumed with anxiety that it's difficult for them to be present in this moment, right? To learn those things that we want them to learn. So I want you to think today, what do you really believe engagement is? You actually have to define it for yourself. Because a lot of times we just assume students know what engagement means and what it means for us. But it means different things for different people. And so we really have to have a conversation about what engagement is to each and every single person. Because we've got to define it to be able to measure it. You may be thinking, okay, engagement just means I showed up today for this webinar. You've participated. You're engaged. But think about that going another step where you put in a comment in the chat. That's a higher level of engagement. You just showing up, yeah, that's engaging. But you interacting in the chat is a different level of engagement. So I want you to think about, how are you measuring your students and how they're engaging? What do you want to see, hear, know, and confirm that your students are fully engaged? What is your complete definition? So we have to look at that in relation to the effort and time devoted to the learning activities. We also have to understand that engagement involves behavioral, cognitive, and emotional components. If we think about it, we are more engaged when learning is meaningful. There's a purpose to it. It has meaning to each individual student and each individual faculty. It's interactive and it connects, and that's really important. Engaging connects, no matter what it is. If we're connecting people to people, we're connecting a content to content, concept to concept. Engagement is connecting, and it's connecting to our future goals. Engagement is not a nice to have. It is directly tied to learning outcomes, retention, and clinical judgment. So let's talk about more in depth of these dimensions of engagements related to behavioral, cognitive, and emotional. So engagement is much more than just the behavioral aspects of showing up, following instructions, and attending class. It is a mental investment for cognitive deep learning to promote critical thinking that leads to safe decision-making, practice readiness. Engagement is influenced by emotional aspects. We have to think about motivation. What motivates someone to be engaged, right? So I want you to think about the two aspects of motivation, our extrinsic factors and our intrinsic factors. So the intrinsic motivation is that drive just to do it because it's good to do it. It's just good to do it. It's meaningful. It's enjoyable. I just do it because out of curiosity, I want to know more, or personal growth. In other words, we're doing the activity because the activity itself is the reward. And we also have to think about extrinsic motivation. Now, extrinsic motivation comes with rewards, grades, trophies, badges, right? They're both good motivators, but intrinsic will serve well for long-term engagement, growth, and retaining the knowledge. Intrinsic motivation can decrease and become lost if we've got too many rewards. If it's all about the reward and all about the grade, then we get used to that. And it's just like, well, I keep getting A's and I keep getting A's. There's no real motivation to go beyond that. So I want you to think that there's an over-justification effect where the passion to learn and create is lost when we have too many badges and too many rewards. Educators, we can prevent this by emphasizing and praising self-progression, growth, and competency versus just the attainment of the grade. Why does this matter? Oops, sorry, clicked too many times. Well, research shows nursing students often struggle with complex concepts and do not have the foundational understanding that learned concepts need to be transferable into deeper meaning, not just dumped out learning. Engagement is the key to mastering these foundational hard concepts, retaining the knowledge and progress over time to build clinical reasoning and clinical judgment skills needed for NCLEX readiness and professional practice. It reduces classroom disengagement, which is often linked to a lack of that intrinsic motivation that can cause burnout. And a lot of students are burnout. A lot of faculty are burnout. We've got to understand that. Disengagement is common. In a study by Zoe et al., 70.8% of students were mentally disengaged for over half of our class time. Now, that's concerning. 70% of the time, the students sitting in class, they're disengaged. So we've got to think differently on how we can engage them. Engagement needs to foster connection and enhance satisfaction. Emotional engagement is often overlooked, but it's essential. Students who feel connected learn more deeply. They feel more confident and feel safe to speak up, voicing their thoughts and opinions without fear of making mistakes. The mistakes are where we grow, so we need to allow students to make those mistakes in a safe environment. Cognitively connecting current educational tasks to achieving future goals and competencies promotes engagement and prevents this burnout. It aligns the student with their future self of a safe practicing nurse. And that's what we've got to put before them. When we think about that intrinsic motivator, it's about becoming that future nurse, not just this present moment of getting the A to pass the course or completing this task to get the points, but how is this leading to your future self of becoming a nurse? So the learning principles. There's a need to know. Why does this matter for me? So this is self. This is the student all thinking about themselves. Why do I need to learn this? And I know you've all heard it, right? Why is this important? Why do I have to do this task? And a lot of times we just want to say, because I said so, it's good for you. But they really need to have an understanding of why it does matter for them. The thing that we want to concentrate on is this movement and shift that we see in a student as they engage to where they start thinking, why does this matter for my client? So not learning the information just for themselves to get the reward on the test of getting the A, but why do I need to know this information to help me safely take care of a client. We need to see that shift, that transformation of their mind into thinking that way, so they're engaging purposely full, not for their own badge, but for the client safety. So adults learn best when they can apply knowledge immediately. And I want you to think about that when we're trying to motivate, we're trying to engage the student. What can they learn immediately and apply? To learn effectively and efficiently, the need to know information engages the student. What is the most important thing we need to know right here, right now? That's salient information they have to know to take care of the client effectively and safely. Students learn best when they see future relevance in real-world application. Autonomy is important for students, them feeling they have this control. So autonomy increases motivation, pivoting the student to become self-directed, accountable, and responsible for their own learning. And we all want that for students. We want them to become accountable and responsible for their own learning. But they have to have this motivation. They have to get engaged, and we have to help them in that process. We can't assume they already know how to do it. The use of prior experience and failures, mistakes, can allow the student to reflect and progressively grow. A shift from right here, right now, I need to memorize this information to pass this course, to I need to know this information to safely take care of my clients and save my client's life, changes the perspective to a less self-directed, it's all about me, to a client care directive. And that's what we need them to do. So how can we as educators pivot from I am teaching you the respiratory system to why would a client be short of breath? And that's where we have to change our perspective, because a lot of times we're content focused. I've got to get all this content in this classroom, that we miss out on how do we use this to take care of a client safely. What is the client's need right here related to why I need to know the respiratory system? So we've got to shift as well, and we've got to transform our mind to help those students engage. So let's talk about learning styles, because learning styles and modalities are important. It is a long-held myth that students have a fixed learning style. It's the only way they know how to learn. And this is not true. We need to understand how students learn to help faculty design instruction that increases engagement, retention, and clinical application. But research shows that students perform better when taught in a variety of modalities, regardless of their preferences. Instead of matching styles, educators should use multimedia presentations, combining words, visuals, sounds, and movement to promote active cognitive processing for all students. And it's a right here, right now, how can we use it all to get the students engaged? When we think about engaging activities and what our current generation likes, they can formulate and they can process multiple things at once and be able to make decisions. And the thing that I think about is gaming. As they game, they are actively moving their avatar or their person. They're actively watching things pop up, and they can internalize that. They can do a chat. They can be listening as they're gaming and knowing where everybody is on the map, but also looking at a chat and everybody's chatting on the opposite team. They are internalizing all this information at once. And that's what we've got to tap in to engage them. So what are some good engagement activities? Think, pair, and share. Storytelling, gamification, flipped classrooms, concept mapping, simulation and debriefing, case-based learning, and blended learning. A lot of different things going on at once. Your students can handle it because they're used to that level of engagement. They can watch YouTube videos while listening to music, while texting, while being on Instagram and posting a picture. They can do all those things at once. And we've got to understand that they can process that. They can do that all at once. So active learning increases engagement in clinical judgment. Active learning methods, including flipped classrooms, blended learning, group interactions and connections with hands-on activities, all improve that student engagement, understanding, and satisfaction in our undergraduate nursing programs. But there's no single method that's definitely superior. It's a mix of everything. We need to highlight the need for diverse, well-supported, and integrated teaching approaches that link theory to practice. Concept mapping promotes deep learning and collaborative group work. It helps students transition from rote memorization to applying theory to clinical practice. We need them to draw and visualize these thinking strategies and understand what's especially effective for nursing students who identify as visual learners. We want to combine the flexibility of online quizzes with the connectedness of face-to-face workshops. Get the students to do questions together. Get them to think together. We need to support at-risk students. We need to think about small collaborative learning groups. Students learn through students and through that engagement. Think about this as like a human body club, a human, practice NCLEX club that's more effective than just intensive, specific workshops that we're doing with them. Get the students to engage together and learn together. Kaplan has created and provided several webinars related to these engagement activities. We're not going to be covering all of them, but I've got a few that we're going to cover today. But Christi's going to put a link in the chat on our previous recordings on some of these great engagement activities. And feel free to go back and look at those webinars. They are fantastic. So let's look at, I've got a few that I wanted to kind of talk to you about today, just to kind of think about what you can use in your classroom to engage your students. The first one is storytelling. Now, I want you to remember when you were a student. Did you like it when the instructor started telling the story in the classroom? I know I did. Especially my OB teacher. She would have these fantastic, that's probably why I went into maternity and OB and labor and delivery. These stories were just amazing that she would tell in class, right? Why did it engage me? Why did it perk my interest? It's because it was real, right? Real life story. I wasn't just reading a book and what the book was saying. It was putting it into practice. And the great thing is that I was creative in my own mind. I was visualizing that specific space clinically, right? And what was happening in that space. So I want you to think about storytelling, not only you telling your clinical stories, but making sure that that's concept approach related to the textbook, right? But also having your students tell their stories, their experiences. So this provides arousal and focus. High acuity stories trigger attention. You grab their attention, and that's what we need. It also provides that visualization, creating high resolution cognitive imagery that each student is using. And all these synapses are firing, and that's what we want. It provides validation, normalizing anxiety through shared experiences. So a lot of times students are scared or something may have been frightening. And that's where that debriefing is important when we tell that story. Another example is gamification. This is mechanics for motivation, right? Escape rooms are great. And this is where they can come together and collaboratively problem solve under a pressure situation. Serious games, think about safe environments to fail. So think about, kind of our simulation labs, right? A virtual simulation, safe type of situation. And then if we can get that gaming aspect in it where they get a badge or they get a reward, have a challenge. Think about competition. Students love competition. So in your room, think about the competitive edge. I used to play like Family feud, and I had like an easy button, and they loved hitting the easy button to grab that answer really quickly, or Jeopardy in that classroom. The benefits, it increases the use of your learning materials, improves student satisfaction, and keep it fresh. Novelty effects in gamification can fade without any variety. So you want to make sure that you're mixing it up with the gamification. Another interactive activity is micro-teaching. It is great for your students to teach, right? Flip that classroom and have your students teach mini 5-minute lessons. They could be in a group and just teaching each other. Have them respond. The peers respond and provide immediate feedback. Have a group debrief, and then also have them talk about the muddiest point. We need to get students to feel comfortable with making mistakes and talking about the mistakes and learning from those mistakes. That's how we grow. If you've got a large group, you can always use your LMS to do a discussion board for that muddiest point and to talk about it. Get the students to engage in Socratic questioning. And that's important. Not just what is that normal blood pressure, but really get them to, why do you need to know if the blood pressure is low and the heart rate's high and that respiratory rate's going up? Why is that significant? So really get them to think together. Case-based groups. So case-based learning mirrors clinical reasoning. Encourage rotating roles to build teamwork skills. Students prefer active collaborative learning. They want to learn together. So provide an evolving case and have them work together. Have them change roles in the setting as the case evolves. Have them answer guided questions and collaborate to find the answers. Present the findings to the class and have them talk about it. And again, bring in that muddiest point. What are you having difficulty with? Another great activity is to engage your student in remediation. And a lot of times we have difficulty getting them to engage in remediation effectively. One of these things that I like to do is do my ADPI. If we can get the students to use the nursing process on themselves, they're going to be able to apply it to our clients. So what I mean by this, have a student take a practice quiz, and then they need to go in and assess. They need to assess their data. They need to look at all of the information provided related to their scoring, right? Analyze that. Where are my weaknesses? They need to analyze how did I feel when I took the test? Did I get distracted? So they need to think about physically, mentally, and emotionally, how did I feel when I was taking this test? Did I go too fast? Did I go too slow? Think about timing. So they need to really find opportunities for growth, and they need to diagnose themselves. They need to know, what are my problems? And then they need to plan for improvement. I'm going to read the book. I'm going to watch the video. I'm going to do a virtual simulation. Whatever they need to help them understand how to use this knowledge into clinical practice, that's what they need to plan so they can grow. Have them create a concept map. One of the things I love for them to do is get that cell phone out and use it. Record their plan. Record what their weaknesses are. And they've got that recording, so if they can see trends, are they trending constantly? They're going too fast and they miss words. Well, that can help them to say, okay, I need to slow down. And then have them implement those actions. Once they've implemented those actions, they've studied the content, they've slowed down on the next exam, then have them evaluate if that plan was effective. Have them create a custom quiz for themselves to take to see, am I better? Now, I want to highlight, for conclusive evidence of the impact of student engagement on professional readiness, we want to refer to our key findings from our 2025 Kaplan Nursing Institutional Efficacy Study. This was recently published by our own right here, Dr. Doherty. This research establishes that a strong direct correlation between student engagement and successful NCLEX licensure outcomes. Specifically, students that engaged in at least 140 diverse learning activities demonstrated a remarkable 98.2% first attempt pass rate. The numbers show a clear link between engagement with consistent practice, active remediation, and building critical thinking skills that are essential for mastering clinical judgment. This is truly being engaged in a diverse, robust, consistent cadence of practice and meaningful growth experience that make a difference in reaching goals. Dr. Doherty is going to put that link in the chat so you can get direct access to that information. But it's an exciting research to show that as students engage in more diverse activities and the volume of activities, it truly shows positive outcomes. Now, the last slide that I have for you is about our expectations with engagement. Engagement is difficult, and I understand it's difficult, and there are barriers. I wanted to make this slide fun. And fun because barriers are normal and they're often systemic. They're not personal failures. So you as an educator, don't think it's a failure that if your students aren't engaged. Sometimes we have to unlearn to relearn. The research by Bowser et al. Demonstrated students in remote learning reported feeling a disconnect, constant fatigue, and difficulty focusing. They didn't want to engage. Overload and unclear instructional design reduce engagement. So we have to think about that. What are some of our solutions? Start small and build. Grow, right? Water, feed. Consistent changes have the biggest impact. Structured activities reduce fatigue and increase motivation. Think about those actions, those knowledge deficits your students have. They need to feel safe and not anxious about discussing the muddiest points. We want those discussions with our students to self-identify confusion and stay engaged. Technology improves engagement only when paired with clear organization. Engagement is a connection we make. Sometimes faculty must engage before students will engage. Be the coach, be the guide, be the roadmap. Avoid assuming and begin that connection. I want to thank you. I have my references here for us. So lots of different references that we can explore with motivation. And now I'd love to open it up for Q&A.
I want to jump in and start, Julie. That was a great presentation. Just hit so many good points and some practical ways that faculty can use this to make their students more engaged in the classroom. So thank you so much for that presentation. I do have a follow-up question for you. As you were talking about the diversity of learning styles that are in our classrooms, how can we intentionally use Kaplan resources to meet the students where they are and at the same time challenging them to move beyond their preferred way of learning?
And that's really good, because what happens is in all of us, right, as humans, we get stuck in what we're comfortable with. And so sometimes we don't engage in something new because we're fearful, we're anxious about it. But the thing is we've got to get students to step out of that comfort zone and try new things. That starts with us. So related to Kaplan resources, I recommend faculty pull those Kaplan resources straight into that classroom. The channel presentations, use the case studies, use the NCLEX style questions, use them in your classroom to engage the student in a conversation to really think about how to apply that knowledge in these clinical case study situations and how to tackle different item types related to NCLEX style questions. We need practice with questions because we've got to get the students to think cognitively. How do I get this on paper, or how do I get this knowledge, this application into a test item? So pulling in focused review, our practice questions into the classroom itself, having your students do an exam in class, and then just do a 5-question practice test that they create. And then in groups, talk about that. Talk about, oh, what was my weakness? What content did I not know? And then they can learn from each other. And then pull in the content library video and have them watch the 2-minute library video, and then see how that helps their knowledge improve by just watching this video. They can also do a mid-fidelity simulation, and they can do the parts at the beginning and some micro learning at the beginning before they come to class. In the class, you can engage them into that virtual simulation, and then you can have them do after class activities. So there is just the more you engage the student in the classroom with the Kaplan resources, be that guide, be that coach, and start asking those Socratic questions to them as they're practicing an NCLEX style question, as they're watching a content video, or they're watching a specific channel presentation. Then you're getting them to think outside of just watching the video. Get them to really incorporate that into clinical practice.
Love that. Great practical advice there, Julie. You can tell you've been in the classroom and you've really brought those students in and engaged them. So that's good to hear. A lot of people, there's some people listening that may be fairly new in the classroom, or even if they're experienced, bringing another activity into the classroom can be challenging. So what do you think, what faculty practice do you think would make the biggest difference in helping students move from simply completing, say, Kaplan resources to really learning from them? You've given us a lot of examples, but I want you to kind of pick just a few.
In relation to, engaging those students, and sometimes we have activities that just feel mundane to them, that I'm just doing it to complete as a task, right? We've got to give meaning to it. So we want to give them the why. They're going to ask you why. You want to give them the why. Why are we engaging in this activity? Let's take, for instance, practice questions, right? Or a standardized test. Why am I doing this? Now, as faculty, of course, we want to get the assessment data, right? We want to be able to see gaps, not only for the individual student, but for the cohort or for the curriculum at large. But we also want students to understand that tests can be tools for them, tools in engaging of what I do know and opportunities for growth. And that can be with all of the information that Kaplan gives after a test. We provide category comparison reports to our students. Not only just here's your performance, but also clinical concepts. What are you weak in? Are you weak in communication? So when you go into clinical, think about working on those communication aspects. And as faculty, we can see that data, and that data can drive and target what we need to do for that specific cohort in that course, to drive and target what they need to learn. A lot of times we are structured, and there's certain content that we need to engage the student in during class time and during that didactic portion. But also think about, after a student has taken a test, look at the Kaplan reports and determine, what is the weakness of the entire cohort here? What kind of an activity could I pull into the classroom where they can understand and grasp these concepts so that they can apply it as they go into that clinical situation? I think it's very important. Sometimes we're in silos of our didactic teachers and our clinical teachers, and we're not connecting on what the students need to learn and need to grow together in both spaces, connecting that theory to that clinical practice. So we need to just open up the conversation and engage with one another, so that way we can target in on what students are weak in.
Good advice. Good advice. Well, lots and lots of thank yous in the chat, Julie. I don't see any more questions, but such a wonderful presentation. We all, I think, have learned something from this, and we really appreciate your time here. Any final thoughts you'd like to give those that are listening?
Get out there. When you think about, first thing, think about engagement and what it means for you, because if it means something to you, you're going to emit that into your class, and that's what you want to do. So you want to spark their interest, right? Grab them initially. Be you, and just share you with your students, and that's going to engage them. Sometimes we're afraid. We're afraid too as faculty to engage with the students, but the more that you connect them with that real world practice, the more they're going to want to engage with you and with the resources that you're giving them to learn. So thank you for attending today. We appreciate all that you do. And thank you for educating our future nurses.
Thanks so much, Julie. Goodbye, everyone. See you next month.